As you all know and have heard since the beginning of the symposium, we have seen in the last 20 years or so an increase in programs aimed at engaging men and boys as allies in the struggle to end violence against women. But very few have been thoroughly evaluated. And some of these programs, unfortunately, have left the foundations of patriarchy untouched. In the area of negating the need for research and evidence-based decision-making, dialogue between researchers and practitioners in the field is needed more than ever if we are really want to make inroads in ending violence against women. Between 2014 and 2020, the SBRI and the World Bank Group ran a joint-making program aimed at supporting research on violence against women and violence against children in low and middle-income countries. Under this program, research on the topic of engagement and voice to prevent violence was funded. And today, we are going to hear about the research findings of 4 grantees from Peru, from the Democratic Republic of the Congo, Uganda, and Kenya. Our distinguished panel today includes Nancy Palomino, who is a professor at the Universidad Peruana Cayetano Heredia, Peruvian University, Gary Barker, who you all know, CEO and president of Promundo US, Fiona Nasserian Koyet, who is a senior technical advisor at World Vision International, and Jennifer Wagman, an assistant professor at UCLA Fielding School of Public Health. My co-facilitator today will be Diana Jimena Arango, who is a senior gender-based violence and development specialist at the World Bank, and with whom we have had the pleasure to work in the grant-making program. Diana has been key at the World Bank in promoting programming and resource allocation that is based on solid evidence and also contextually relevant. So this is our panel today. I hope you enjoy the conversation. And before, though, we want to put a poll to you before we go to the panelists. We have prepared a little poll with some questions, just so you can test or refresh your knowledge about programming involving men and boys. So if you go to the bottom, there are 3 dots where it says more. I would like you to click on those 3 and you will see polls. Go to polls and you're going to see 3 questions. Read the questions and please answer what you think is the correct answer, and then I'm going to tell you what is the answer. So the first question is, which of the following circumstances are examples of sexual violence perpetrated against women? And there's here 4 options. When a person is pressured to have sex despite not wanting to engage in sexual activity. When an intimate partner says no to sex, but the individual says it is their right to have sex with a partner. When a person uses physical force to have sex, or all of the above. So that's the first question. So Bianca, you can help me a bit about how to mark the poll here. I cannot see from my side, I don't see I cannot vote. Okay, sorry, I couldn't vote, but anyway, hope everyone could vote. There was a second question. Is there a link between mental health challenges, alcohol and substance abuse, and intimate partner violence? Third question, to engage men and boys, we should replicate and make available the same activities and components of interventions that target women and girls. So these are the 3 questions. Go to the poll and vote. And here are the results. So the first answer, the answer was exactly all of the above. The second question, the correct answer was the third, jointly mental health problems, alcohol and substance abuse, and marital conflicts commonly resulted in intimate partner violence. And the last question is, to engage men and boys, we should replicate and make available the same activities. Of course, that is false. Thank you so much for the poll. Thank you, Bianca. So now we would like to move on to our panelists. And the first presenter today is Professor Nancy Palomino from the Universidad Peruana Cayetano Heredia in Peru. Over to you, Nancy.
En primer lugar, mi saludo a todas y todos los participantes y agradecer a quienes han organizado justamente esta sesión, a MenH, por el simposio. Y muy brevemente quería presentar los resultados de la investigación que realizamos justamente con el apoyo del Fondo Mundial. Voy a compartir, como la mayoría contestó la encuesta, ¿no? Que existen diversas formas de violencia sexual. Definitivamente este es un tema que también es de altísima preocupación en el Perú. Pero nuestro estudio quiso centrarse en la violencia sexual por parte de la pareja, porque esta es una forma de violencia menos reconocida y muy invisibilizada. Entonces, casi no hay denuncias acerca de la violencia sexual, por ejemplo, en el matrimonio, a pesar de que las encuestas sí señalan una proporción importante de ello. También es importante en el marco legal que solamente desde el año 1991, o sea, hace 30 años, se reconoció que existía violencia sexual dentro del matrimonio. El estudio fue un trabajo que se hizo con varones de 20 a 50 años de edad en 3 ciudades de estratos socioeconómicos medio y en situación de pobreza. Se aplicó una metodología cualitativa en la cual participaron 29 varones que fueron entrevistados a profundidad, y también se realizaron 12 grupos focales en los cuales participaron aproximadamente 100 varones, eso en las 3 ciudades. Lo que queríamos era explorar los significados que los varones otorgan justamente al ejercicio de la violencia sexual, o sea, qué era cuáles eran las ideas que ellos tenían o cómo explicaban la violencia sexual contra las mujeres. Pero al mismo tiempo también cómo se construye su identidad masculina y cómo explican la complicidad masculina con la violencia sexual. Los resultados del estudio se publicaron en este libro, Detrás de la Máscara, que está de acceso libre, y yo voy a presentar solamente algunos de los resultados del estudio. En primer lugar, a partir justamente de las entrevistas a profundidad, se exploró las trayectorias de estos varones y se encontró que principalmente había una socialización sexista y machista en la familia desde muy pequeños, y también la represión de emociones asociadas a lo femenino como una característica transversal generacionalmente, digamos, por la amplitud del rango de los que se entrevistó, y también en las 3 ciudades no hubo mayores diferencias. Y varios de ellos además relataron experiencias de violencia en la infancia, ya sea como víctima o testigo de violencia de su padre contra su madre. Luego también se exploró las experiencias fuera de la familia, y se encontró como factor muy importante la socialización entre pares, y como característica un ambiente homofóbico tanto en el barrio como en el colegio, los amigos, ¿no?, los familiares más cercanos, el aprendizaje de una sexualidad machista, y también el acoso sexual callejero cuando ya crecen algo, en complicidad con sus pares, casi como un rito de pasaje de ser niño a ser considerado un varón, como una manera de afirmar su masculinidad frente a sus pares. Entonces, esta construcción de la masculinidad lo que hace es que se interiorice en ellos la idea de que el poder masculino está asociada justamente al sometimiento de las mujeres. También a partir justamente de estas experiencias de acoso sexual, que se normalice el ejercicio de la violencia sexual. Un constante miedo a ser feminizado es como una característica común, y también creencias acerca de la sexualidad masculina, entre ellas que es una sexualidad irrefrenable, que es obligatoria, o sea que siempre tienen que estar dispuestos a demostrarla, que es competitiva, penetrativa e irresponsable. Y el modelo de pareja, digamos, se inscribe justamente dentro de una matriz heterosexual obligatoria. En cuanto a los significados de la sexualidad y la violencia sexual, hay, digamos, como varias características que nos hablan de cómo los hombres se creen propietarios del cuerpo de las mujeres, sobre todo si son sus parejas. Creen que tienen derecho a acceder a los cuerpos femeninos cuando ellos lo desean. Con relación al matrimonio, persiste la idea del débito conyugal, no solamente matrimonio, sino también convivencia e incluso enamoramiento, es decir, que la mujer está obligada a tener sexo con ellos. Cuando son rechazados por sus parejas se sienten humillados porque justamente consideran que su masculinidad estaría amenazada y buscan restaurar el poder masculino usando diversas formas de coerción sexual. Ahora es interesante que estos hombres consideran que hay violación sexual solo cuando se usa la fuerza física y no perciben que hay un conjunto de estrategias que ellos desarrollan eh, que creen que son legítimas para lograr un consentimiento entre comillas, porque en realidad viene a resultar un asentimiento de parte de las mujeres, ¿no? Entre las estrategias está la insistencia, el chantaje emocional, eh, económico u otros, y la manipulación hacia sus parejas. También pueden crear un ambiente de temor y violencia, o sea, desplazar la violencia no hacia ellas, sino hacia el entorno, los hijos, por ejemplo. Y es así que el consentimiento se da en un contexto de desbalance de poder, que prácticamente hace que las mujeres acepten tener relaciones para evitar estas diferentes expresiones, digamos, de violencia de parte de los hombres o este ambiente que se genera. Y también encontramos que incluso desde adolescentes ellos se aconsejan, ¿no? El cómo conseguir tener sexo con una mujer, por ejemplo, usando el alcohol, invitando a las mujeres bebidas alcohólicas para que ellas justamente bajen sus resistencias y acepten estar con ellos. En el grupo que no fueron muchos, de los 19.5, que sí reconocieron que violaban a sus parejas, se les preguntó qué era lo que sentían o qué era lo que ellos pensaban cuando violaban a sus parejas. Ellos reconocieron que buscan humillarlas, herirlas por el atrevimiento de ellas a negarse justamente a tener sexo con ellos. Y sienten que deben afirmar su poder y su masculinidad a costa de ellas, y en ese sentido lo sexual pasa a un segundo plano. Eh, los hombres aparecen autocentrados en sí mismos, no son empáticos frente al dolor que ocasionan, y aun cuando sientan culpa, esta es experimentada desde su ubicación de poder, es decir, pueden repetir la situación, no es una culpa que les lleve a modificar su conducta. Y también encontramos que en realidad persiste una alta complicidad entre los varones al aceptar como legítimas diversas formas de violencia sexual y una tendencia a atribuir la culpabilidad a la víctima y no reconocer la responsabilidad masculina frente a la violencia sexual. También, en general, en los hombres adultos, sienten pánico que se dude de su orientación sexual. Entonces, un elemento que también encontramos fue la violencia sexual entre hombres, incluso entre hombres heterosexuales, y esta violencia sexual es invisibilizada y temida. No hablan mucho sobre ello. Estos resultados los utilizamos para mejorar los contenidos de nuestras intervenciones educativas. En principio, en el proyecto habíamos planteado desarrollar talleres con activistas y profesionales que en el Ministerio de la Mujer venían trabajando la problemática de la violencia. Y realizamos 3 talleres en Lima, Arequipa y Cusco, y participaron no solamente hombres, sino también mujeres. Y luego desarrollamos, terminado el proyecto, desarrollamos también otras experiencias basadas en estos talleres piloto que realizamos. Lo realizamos con profesionales y activistas a partir de la universidad. Se han hecho prácticamente 7 cursos con esta perspectiva. Y en este momento estamos realizando, por causa de la pandemia, un diploma virtual, el que ven ustedes en el extremo izquierdo abajo. Es un diplomado sobre masculinidades y violencia de género que ya se inició. En los contenidos de los talleres abarcan los temas de género y sexualidad, masculinidades, violencia sexual, por supuesto, el tema de los derechos sexuales, las políticas de prevención de la violencia sexual, y lo que buscan estos talleres es justamente que los participantes se comprometan con el cambio, comenzando con un cambio de sí mismos y proyectar diferentes actividades de sensibilización o de formación en sus comunidades. Las metodologías que se usan son metodologías vivenciales, justamente que permitan la reflexión de la propia experiencia, técnicas participativas, exposiciones, debates, análisis de casos. Esa es nuestra experiencia. No hemos medido el impacto, digamos, no tenemos una medición del impacto de estas intervenciones educativas, pero sí lo que hemos podido desarrollar es sinergia con nuestros egresados. Incluso una de ellas ha desarrollado en la ciudad de Arequipa un simposio universitario sobre la violencia sexual, que primera vez se hacía desde esa universidad, y sabemos que este trabajo es arduo, es difícil, porque cambiar las mentalidades toma tiempo y cambiar las prácticas también. Muchas gracias.
Thank you very much, Nancy. Thank you. And yeah, always interesting to hear more about the work in Latin America from my side. So we are going to leave the questions till the end. And now we're going to move to Africa and welcome Gary. Gary will present, you all know, of course, the work of Promundo. Gary will present on living peace, evaluating the IPV prevention impact of an intervention with male partners of women survivors of conflict-related sexual rape in the DRC. Over to you, Gary.
Thank you, Angelica, for the invitation. Can everyone see my slides?
Yes.
Yeah.
Great. First of all, I want to share greetings from the colleagues in DRC. They would be and should be presenting this today, a combination of scheduling issues, and many of you have also seen the news about the volcano eruption in Goma. So between internet and needing to take care of themselves and partners during this moment, they asked if I would present this. This work was authored by 2 researchers, Marianne Tankink and Henny Slag. Henny continues to be the lead mental health specialist for this initiative that is a partnership. The study was a partnership between Promundo and the Living Peace Institute. Oh, sorry, I'm having trouble getting my slides to pass on there. There we go. We know from multiple settings where Promundo and partners have carried out the International Men and Gender Equality Survey that conflict-affected settings have higher rates of men's use of multiple forms of violence against partners. And we've used that data to understand how violence, displacement, stress in men's lives and in women's lives, of course, also contributes to increased and different forms of violence against women, including self-harm to men themselves, alcohol abuse, poor mental health behaviors, and how that creates layers of trauma for men and for women. What we tried to bring with that understanding in the case of DRC was particularly looking at how trauma in men's lives, in fact, is one of the drivers of men's use of violence against female partners. Specifically, the Living Peace intervention was born out of carrying out images in DRC, where we found a large percentage of men feeling a sense of shame due to displacement and loss of livelihoods. We also knew and saw from our data, and many other researchers have found very high rates of sexual violence in the context of the conflict in Eastern DRC. In our sample in Goma, in North Kivu, nearly 1 in 4 women and 1 in 10 men reported experiencing some kind of sexual violence in the conflict itself that is related to the conflict, apart from rape in the context of, or sexual violence in the context of a marital relationship or outside of that. High numbers of, and a large percentage of rape acceptance. And what we also saw was a very common pattern that about half of the time, most of the time, men knew that their partners had experienced sexual violence during the conflict. One of the very tragic effects of the conflict or characteristics of the conflict in DRC is that combatants sometimes make other family members witness a sexual assault or a rape. And so men often know when their partner has been a victim of the sexual assault. And when it happens, about half the time, men kick her out or force her to leave the household. There's often an issue, cycles of blame, men's own trauma turned into she must have done something to provoke it. She must somehow be complicit in it. Men's own sense of shame about it often turned into rejection of their partners. And then we also saw a very high rate of men's subsequent use of violence against a partner after a conflict-related rape. Again, his own trauma turning sometimes into rejection and kicking her out of the household for some amount of time, and sometimes in more than 40% of cases also turning into his use of physical violence against her. Based on that research, we worked on a model with the belief that it needed to not only think about changing the norms that we know are associated with men's use of both physical violence against a female partner, but also related to sexual violence against women, to look at trauma, to understand that men in the same context where women have been traumatized, obviously in far different and many abhorrent ways during the course of the conflict. But we also needed to think about an intervention with men from a trauma lens. And so much of Promunda's work and much of previous work has been educational models of trying to change norms that drive or that are associated with gender-based violence. What we tried to do in this model is create what essentially is a group therapy model. The groups of adult men include men who have used violence against a partner. Others are ex-combatants. Some have been involved in carrying out forms of sexual violence. And we've also carried out groups together with the military and the police. And all of these populations of men we continue to work with. Generally in the groups, they run in size from 15 to 20. About half of the men in that group, we know at baseline, have carried out some kinds of violence against a female partner. We also did something different that's not frequently done in such groups, which we deliberately included some number of men who are seen in their communities as men who cope better, men of integrity, or different expressions that were used to describe men that they went to in moments of problems, and men that they also looked up to as treating their partners and families well. And we thought it was very important to not bring into an idea that you are all damaged and we bring the help from outside, but to build on a model that said there are coping mechanisms, there are men who, even in this difficult situation and the multiple levels of trauma and stress, have not apparently used violence against their partner. The model itself is 16 group sessions. There is individual therapy available for some men who need it or request it. And that's been an important partnership of the model with folks who work on community education, as well as individuals who are trained in trauma therapy. The sessions are with individual men, but they start off at the beginning with sessions where the female partner wants to also be present. She is invited there. The vast majority do come to that first session. And she is also invited to a final 2 sessions one of which, and this was a suggestion of community members, is done with the wider community. Now, in some parts of the world, that would be considered a breach of confidentiality, but in discussing with local colleagues, Congolese colleagues thought this locally made sense. The issues of sexual violence took place and were known in the community. The expulsion of women from households where by men was known in the community, and they thought it was appropriate, and participants did as well, to have a community conversation where they often sometimes disclose what has happened in their household. Many times it's not even disclosure because the community knows what has happened to certain women in their community. In those community sessions, there's a discussion of impact on others. There's a preeminence given to women being able to talk about their experiences and what they perceived happening in their male partners as they went through these groups. So we see the group as a combination of group therapy, getting men to assume responsibility for actions they carried out, a collective accountability in the sense that the community and female partners are listening to men tell their stories and are questioning, calling out. And we believe in the follow-up that we actually see some community social control over holding men accountable for violence. We were able to do, with support from SVRI and the World Bank, did a limited time series qualitative research among 40 former male participants and their households. Altogether, it involved about 155 participants between individual interviews with the former participants, as well as women interviewed in some focus groups as well. And here's the timing of when it was carried out. This intervention carries on, so it did not end at that moment. In fact, it has expanded with support from the Dutch government. Activities are carried out both in North Kivu and in South Kivu, and here's some of the numbers that I mentioned. Between the individual interviews and the focus group discussions, it's 153 participants. It's about 43 households. The overall finding is that there were mentions of violence reduction in more than 95% of the households. We do not, with this study, have a control group. So we are, of course, listening to self-reported data, and we don't have a comparison group. But we nonetheless feel quite solid in what those responses give us. At the community level, we heard stories of adopting nonviolent behaviors, conversations around norm change in terms of gender relations, particularly household relations, men's sense of agency in terms of, or some of the same issues that Nancy brought up about men feeling entitled to sex, to moving to a consent and discussion, and even mentions of her sexual pleasure and an awareness about sexual relations in a more gender equitable way. Discussions by men of the importance of supporting their girls going to school. Women reported frequently this notion of there's now peace at home, including how he treats the children, including how he treated her. Discussions by women of her being more involved in the household decision-making. And many women said after their husbands participated in the group that actually he was bringing home more money, spending less on alcohol use, and that they felt that their socioeconomic condition had improved as well. Many men reported that they had stopped using violence against a partner. There were stories of acceptance of wives who had been survivors of sexual violence during the conflict, acknowledging that she was not to blame in that, which many men did blame her beforehand. Some reports by men of more engagement in household tasks and childcare, which we think in the Congolese context is a tremendous change given how normative it is that men don't participate in household tasks in DRC, at least among the population that we're working with. Men reporting greater communications with their wives. And often, and this should connect to the first one, often men discussing reductions in alcohol abuse and that being a pathway to them reducing their violence against their partner as well as against children. On the strength of what, and again, just repeating this, on the factors associated with the positive behavior change related to IPV, we really think that it's important that both this combination of positive coping skills, men could tell us in some of those interviews ways that they dealt with stress in different ways after participating in the groups. That in turn related to stopping or reducing their use of alcohol, and then stopping using certain forms of violence. And men also relating that when they did that, they saw not only improvements in how their or benefits to their wives and to their children, but also they themselves perceiving a cycle of the relationship got better. They described that their relationship took on different meaning. That is, their partner and their intimate partner relationship changed. What we also found the need to do was to increase the amount of individual therapy offered. That men and women, and there are quite a few, with severe mental health problems and or addictions needing specialized mental health services, and follow up subsequent rounds of intervention, both with men from the communities as well as military men and police. We have, the Living Peace Institute has enhanced what they're able to offer in terms of individual therapy. We think there's a need for more research that looks at this connection between men's trauma and intimate partner violence, as well as men's use of other forms of sexual and gender-based violence. We think a model that brings women in terms of discussions at the beginning and at the end, and when it's appropriate to make those at the community level, helps build a sense of social accountability as well as accountability within the relationship. And we think more needs to be studied on that. And then I'll just end on a note that based on the strength of this study, and again, our thanks to SVRI and the World Bank for the support to do this first short-term or smaller scope qualitative study, there is a randomized controlled trial going on right now of the intervention. It's being carried out by researchers at the University of Kigali. Inline data has been collected, and we hope to be able to share that in the coming few months. It is completely externally carried out. We thought that was important as well. So we have not even been able to see the data yet, but we will be sharing that publicly in the coming months. Thanks, and I will end there.
Thank you so much, Gary. And as usual, it's always great to see and to be reminded of the pioneer work of Promundo in this field. So thanks again for that. And now we have for the audience another little exercise to see also how you are following up the conversation. We are going to have a word cloud exercise. And what we would like you to do is to click in the chat. You're going to see a link there. And the idea is that you answer in one word to this question. What is one word that you would use to describe accountability to women and girls in the field of engaging men and boys in violence against women prevention? This in research and program. So check the chat, click the link, and write one word that you describe as accountability in this space. This call is called the Mentimeter. So click there and write your response.
You're on mute.
Thank you for your participation, and you will see the result of this little exercise towards the end of the session. And now we are going to move to another part of Africa, and I would like to introduce you to Fiona Nasigan-Koyet, who will present on mental health and problem management support for men to reduce incidences of sexual and gender-based violence in urban Kenya. Over to you, Fiona.
Thank you. Thank you very much. I would like to introduce our study that we did carry out in urban Nairobi. This is an area that is mostly faced with GBV by characteristic, and that's the reason we did choose the area of our study. A problem management plus, as it is based on WHO intervention, is one of the interventions that we wanted to adapt in our study. And the overall objective or aim was to actually to explore whether a mental health intervention, a scalable ecological intervention, would be viable to reduce the incidence of violence against women in two peri-urban communities in Kenya. The objective was to test the feasibility and acceptability and effects of reducing violence using a WHO adapted intervention, group problem management plus, for men with common mental health problems in the targeted areas, and inclusion of community messaging about violence against women, whereby we were able to pilot this in the targeted locations. Now, as I said, we did adapt a WHO psychological intervention, which is known as Group Problem Management Plus, which is a low-intensity intervention that has had rigorous trial in various settings, low-resource setting. It is an intervention that has 5 key sessions, and it is an intervention that is delivered by trained and supervised lay community providers. And in our intervention, we did adapt a protocol to be able to integrate the aspect of alcohol abuse and also intimate partner perpetration. And in our study, before we began with an ethnographic study for us to be able to understand, to explore the links between common mental health problems, alcohol and substance use, and perpetration of intimate partner violence. And in our ethnographic study, we use a free listing exercise. We also use key informant interviews, and we also use focus group discussion to be able to understand these issues at the community level. And from that ethnographic study is what guided our adaptation of the WHO intervention. And just to mention, the WHO Problem Management Plus was an intervention that World Vision tried in previous study, and actually amongst women with a history of gender-based violence. And it was effective in the study that was done in Kenya and Pakistan through a randomized controlled trial. After that study is what led us to think that perhaps maybe this could be potentially also an intervention, because it is evidence-based, that can be explored and implemented with men with a history of common mental health problems, alcohol abuse, and intimate partner violence. In terms of our study characteristic, we did target 730 men, whereby we had a screening for eligibility of this number, because we had about 99.2% who met the inclusion criteria and agreed to participate. This intervention was delivered in groups, and then we randomized the groups, of course, based on age and also based on location status. And then we had 257 men, about 80%, who were able to complete all the assessments. So we had a pre-intervention assessment, and then we had a during intervention assessment, and then we had a post-intervention assessment. And these groups, they had an average of 5.1 sessions, and each group had an average membership of 5 members or up to 10 members. And the groups were organized in 6 sessions, whereby the 6th session was an inclusion of our adaptation. And we also, as we randomized the men into group, we were keen on the age so that we are not randomized, because this intervention is for adults above the ages of 18. And so what we did make sure is that we are including men who are actually at the appropriate age as shared or as agreed by the community members during the ethnographic study, so that we're not having a 20-year-old and a 40-year-old in the same group. Now, what did we find out, or what did the study tell us? I will quickly share the results, but you can find much more information about our study. And we use a WHO disability assessment, which measures impairment, as you can see on my screen. And then we use a general health questionnaire that measures psychological distress. And then we use the alcohol consumption questionnaire also, or self-reporting. We use a short version of conflict tactics scale for the men as to actually ascertain perpetration of violence. And we also use a conflict tactics scale for partner victim of violence. And you can see from my graphs from baseline, post-treatment, and 3 months follow-up, in all the measurements, there was reduction in impairment, reduction in distress, a reduction in alcohol consumption, perpetration of violence. Though you can find, or when you look at my screen, the partner violence was not significantly indicative. And of course, one of the challenge was, which I will talk, is the sensitivity of the tools and the initial perception for self-reported tool to assess intimate partner violence. The other measurement, this was the primary outcome of our study, is of course the symptoms of post-traumatic stress symptoms or post-traumatic stress disorder symptoms, where we use a live event checklist, and also we use a PTSD tool, PSL5, to actually assess whether PTSD was indicated. And you can still see at baseline, post-treatment, and 3 months follow-up, the study did actually demonstrate that there was the reduction. In terms of tobacco use, is what men had indicated as the type of whatever substance they were using, and of course, cannabis use also reduced even after 3 months follow-up, when you use the p-values of 0.5. Now, we also assess using a WHO service recipient inventory to check whether there were changes in men utilization of health services and days unable to work. And if you look at my screen, it was still indicative in terms of hospital and outpatient visits in the past 30 days. Medical purchase also reduced, and as well as days unable to work was also reduced as a result of the intervention. The other thing is, of course, the study had some limitation in terms of its inability, because this was only based on a pre and post. We did not have a comparator control group. And of course, the study design was not systematic because we did not have a randomized control trial. And so we are only measuring our intervention based on pre and post, and also limitation of the measurement tools, as I've described in terms of the conflict scales, which was a short version of it. And of course, because the study was only to ascertain whether this is potentially something that warrants a randomized control trial. And of course, based on my quick summary of the study, it was, and we've seen this particular study being able to inform programming around integration of mental health and aspects of gender norms. Like in one of the objectives, we were also including violence against women intervention in terms of group discussion to change the norms. It was not indicative in terms of our finding because of the sample size. However, this study has informed other programming and even adaptation of the WHO Group Problem Management Plus in GBV programming. I would like to end there because of my time, and thank you so much for listening.
Thank you so much, Fiona. And it's always great to hear, and that's the key actually aspect of the SBR grant making, how research is used to influence programming. We believe in research that is actionable. So it's really great to hear from your side on the example of Rakai. So now, staying in East Africa, a welcome Professor Jennifer Wagner from the University of California, Los Angeles, the Fielding School of Public Health, who will present on a project aimed at designing a gender-transformative intervention to involve men and boys in the prevention of IPV against women and girls in rural Uganda. Over to you.
Great, thank you so much, Angelica, and hello to everyone. Thank you for the invitation to come today. I'm really honored to be here. And I am, as mentioned, at the University of California in Los Angeles, and today I'm going to be presenting on behalf of myself and my colleagues from the Rakai Health Sciences program, some of which I believe are able to be with us today and will join me during the question and answer session. So I would like to recognize Doctors Fred Nalagoda and Gertrude Nachigozi, and also Nema Nachanjo and William Dachi and Robert Sekubugu. So as mentioned, I'm going to be talking about research that we were able to do with support from the SBRI and the World Bank to try to understand some of the gaps that have come up over the past several years of doing research in the Rakai district of Uganda, which I've shown on the map here. It's on the border of Uganda and Tanzania. All of this work was done with the Rakai Health Sciences Program, which is a ongoing research and service provision organization. It's actually been in operation in this part of the country for the past 30 years. And over this period of time, we've learned many different things in the field of HIV/AIDS prevention and service provision, including the fact that one of the big gaps in care and treatment and prevention is that we've tended to see that adoption of services of a variety of different kinds tends to be lower among men and boys compared to women and girls. And this has really contributed to ongoing challenges with HIV prevention, as well as high fertility rates and delayed treatment of other reproductive health services. And between 2005 and 2009, we actually were able to do a very comprehensive combination HIV and intimate partner violence prevention intervention, which is known as the SHARE project. And this was a very exciting endeavor. And also by doing an evaluation study, we were able to tell that exposure to this combination HIV violence prevention intervention, we saw decreases among women's reports of their experiences of violence. We also saw a reduction in HIV incidence in the overall population. However, we didn't see any changes in men's own reports of their experiences of violence, both as survivors or perpetrators. And we also saw that men's participation in certain activities in the violence prevention intervention were quite low. So we wanted to understand what was going on and how we could remedy this. And we had actually, this wasn't all that surprising because it was quite consistent with what we had seen from the literature in other parts of the world, both overall with regard to men's adoption of health and reproductive health services and involvement in violence prevention interventions, particularly interventions focused on addressing violence against women and girls. So the objective of our project that was done with support from SBRI and the World Bank was to try to understand what were some of the barriers to men's engagement. And our overarching goal was to develop a gender-transformative intervention that would enable us to better involve men and boys and understand from their own perspectives what would help us to do that, to overcome some of these obstacles. So we had 4 specific research aims, the first of which was to do a secondary analysis of data to understand specifics in trends of boys and men's engagement in care overall, but specifically in the SHARE violence prevention intervention. And then to be able to talk with men and boys and others in the community to understand definitions of masculinity and gender norms, and what are some of the social norms surrounding these issues, and try to understand what we could do to address these areas. So, like we've heard from some our previous colleagues, we were also able to do a mixed methods research study. So part of the Rakai Health Sciences program, really its core is the Rakai Community Cohort Study, which is an HIV surveillance cohort that's been in operation for over 20 years. So what we were able to do was a secondary analysis from data that was collected during the implementation of the SHARE intervention that was done to evaluate that specific combination prevention intervention. And to supplement those findings, we did qualitative research in the form of in-depth interviews with men and male local leaders, as well as focus group discussions with men, as well as different types of community members. And this, the qualitative research was done during the period of 2016, actually in 2017. So this overlapped with the funding we received from SBRI. So briefly, some of our results, again, we wanted to understand what was going on with awareness and levels of participation of men and boys in the SHARE intervention. And what we found was that most men and boys were aware of what was going on, and the overwhelming majority participated in some type of activity, but it was really quite distinct in terms of what types of activities men were willing to engage in. And what we found is they were most likely to get involved with more public level activities such as sports events and theater things that were available to the wide population. Less likely were small types of activities. So this was really helpful for us to know to better understand how we could enhance future participation. And related to that, we saw that quite a number of men indicated that they did have certain types of behavior changes when they were exposed to activities. So this was really promising that we thought if we could get boys and men involved, this would actually be quite effective. It had promise. So we wanted to ensure that we were actually making activities and future interventions so that we could engage folks in everything and enhance participation. With regard to understanding definitions of gender and masculinity, we also saw similar things to what our colleagues have mentioned, that in our findings, gender was really understood to exist on a binary. So we didn't see a broad continuum of understandings of gender. It was really male and female. And one of the things with regard to masculinity, this is the first time we had studied this in the Rakai population. We saw that masculinity was really evolved as understood along two constructs that were quite distinct, but also pretty challenging in that they were kind of contradictory to one another. So specifically, we saw that masculinity was described to exist in a construct either in terms of respectability or reputation, which I'll explain a little bit what we mean by that. Is that reputational masculine norms included things like becoming sexually active by the age of 18, for instance, and being attracted to women, not men, so very heteronormative, having high sexual stamina. With regard to respectable masculinity, this was marked more by a man's ability to find a female partner, get married, and have children. And we found that these two constructs of masculinity really created conflict with one another in the lives of men and boys, as well as in the way that girls and women kind of understood their constructs and how they existed. So specifically, it was really important for men and boys, according to what they told us, for them to be able to uphold these masculine attributes, both related to their reputation, but it was also really important for them to be able to have these respectability traits, such as having a job and a house and a wife and being able to take care of their family. So these were highly valued, particularly as men grew older. So both of these norms were really used to kind of understand what it meant to be a man, but they were also used to justify dominance over women, as well as perpetration of different types of violence, especially intimate partner violence against female partners. So to understand the relationship between masculinity and violence, particularly violence against women, we examined them in the context of sexual relationships and violence experience in particular, as well as alcohol use, because this is something that came up quite a bit in our qualitative research. So what we saw was that these ideals of masculinity really started to be understood at very young ages. And they included characteristics that are not unique to the Rakai or the Uganda setting, but characteristics related to toughness or stoicism, being able to protect oneself and one's family, and that included the use of violence and aggression if needed. It's important to state and clarify that antisocial acts of violence, such as crime or theft, or violence for no particular reason, were seen negatively. However, violence against women, again, I noted this previously, we saw that this was actually most commonly considered to be very normative and expected as part of a man's job, particularly as he entered into a marriage or long-term relationship. Alcohol was seen as a real hallmark of masculinity, something that really defined a man's ability to be masculine and to be able to both afford to purchase and enjoy alcohol in moderation and at responsible levels. So there was kind of a dichotomy or a continuum here that alcohol was very strongly affiliated with masculinity and manhood. However, not in kind of the extreme form of alcohol use disorders. That was seen negatively. But we definitely saw that this was something that was consistently tied with social ability to demonstrate manhood and masculinity. And this was something that was also attributed to increasing risk for violence overall, but particularly violence against women. So some of the barriers that came up in the qualitative research were that men felt violence prevention programs that had been implemented in this region specifically, but overall in Uganda, did not necessarily account for some of these cultural beliefs or norms that were going on. There was often a sense that interventions were brought in and were reflective of Western cultures, but not necessarily the local culture. Many men and boys, as well as community members that we interviewed, said that they received no formal or informal training on sexuality, gender, or masculinity, as well as what healthy relationships look like and how violence is considered a public health issue. Recommendations were provided for future interventions addressing violence and masculinity. Specifically, it was noted that folks thought we should do a better job of considering how boys as well as girls are educated and brought up in their community and frame interventions and programs according to these issues and the way in which the education system, both formally and socially, culturally, were formulated in this setting. It was also really expressed that it's important for programs to be planned in the local language using local concepts of gender and masculinity, as well as other salient issues that are being addressed, as opposed to this idea that we're bringing in concepts from outside. And lastly, it was suggested that boys and men be involved in all steps of any processes that were being done to address men's use of violence and the way in which masculinity and manhood contribute. So lastly, I'm going to just end up by saying that the goal was, as mentioned at the beginning, to develop frameworks for applying these learnings into ongoing programming. And we have been able to do this since the project ended in 2018. So specifically, Rakai program is one of the sites of the PEPFAR supported DREAMS operations. We've also been doing local clinic and counseling-based alcohol and violence prevention interventions in the form of screening and brief intervention, as well as some programming that is specific for engaging and increasing engagement of men and boys in health, promotion, and violence prevention programming. So I want to end by just thanking again our supporters and our colleagues, and I look forward to questions and discussion at the end. So thank you very much.
Thank you so much, Jennifer. That was lots of food for thought with your presentation, all the presentations that came. And I just now want to hand over to Diana, my co-facilitator, who will facilitate a Q&A session with all of you today.
Thank you so much, Angelica, and congratulations to all the presenters for really interesting and thought-provoking presentations. We have a few minutes for question and answer, so I would ask anyone that has a question and answer in the to drop that in the chat so we can lift that up to our speakers today. While your question and answers come in, our speakers have actually prepared questions for each other to get the discussion going. So I wanted to start maybe with Fiona. I know you have a question for the DRC team. Go ahead.
Thank you, Diana. My question is based on the general perception, I would call it a perception, about traumatic intervention or trauma-informed intervention vis-a-vis, low-intensity intervention, especially in setting where we do not have professional trained implementers. And what is your key learning and recommendation, and maybe on that challenge that trauma-informed intervention typically require at least maybe long session, maybe 12 session or more, hence may not be scalable and feasible in low resource setting. While your interventions seem to have really worked, it's a trauma-informed intervention. And of course, we want to encourage participants that in low resource setting, conflict setting, it's important to integrate a mental health intervention as you respond to GBV or intimate partner violence. So what is one of your learning that maybe you have in DRC in particular using this trauma-informed intervention?
Yeah, thanks for that, Fiona. I think this intervention wouldn't have worked and it wouldn't exist without the partnership of a specific trauma therapy training institute that exists in Goma that's called Institut Supérieur du Lac. And without Congolese trained trauma therapists, I think it would not have achieved what it has. I think it also has benefited from the context that both North Kivu and South Kivu have reference organizations that have worked on trauma for women survivors of sexual violence, Heal Africa in the context of Goma, and the Panzi Hospital and the services they offer in the context of Bukavu and South Kivu. So I think, our work, or the work of the Living Peace Institute and Promundo's partnership on it, grew out of those partnerships and the fact that they had been able to develop a cadre of Congolese professionals working in trauma therapy. I would say that without that, it would be hard to achieve these results. And I think we've also learned that without offering individual therapy together with the group therapeutic model, that it works less well. And I would say a third learning was we assumed kind of at the beginning that we would focus on men and women come at the beginning and at the end, and that women were being well received with services from Heal Africa and from the Panzi Hospital. But along the way realized that while the majority of the women who had been survivors of violence had received some services, they weren't necessarily receiving them at the same time that their male partners were, and that it was important to be able to offer a similar group therapy model for women who wanted that service. So the model has now shifted. There are separate men's groups and separate women's groups. Most of the time, the women who participate, their husband has either been in the group therapy or previously or currently. So I think we also tweaked the model based on those learnings as well. So yes, I don't think this is as easily scalable as some of our educational models. And I think it does require attention to having adequate professional mental health staff available.
Thanks, Gary,
Thank you
for that response. Thanks, Fiona, for that great question. Gary, you have a question for Jennifer, I believe.
Sure. I had one for Nancy, but I have one for Jennifer too.
Oh, okay. Go. Why don't you just ask both questions? That would be great, because people are being shy. Please raise your hands and put your questions in the. We can talk all day amongst each other.
Cool. So yeah, maybe it's a similar one both to Nancy and Jennifer, which is we feel this often in our presentations of men in a different setting, which is it feels like we're often describing kind of frozen pictures of manhood without the kind of the complexity of men who on one dimension may be more progressive or more gender equitable and on another dimension not, or how they act across different relationships or different settings. And I guess my question is around, what do you see pushing us toward, what external factors do you see kind of pushing us toward engaging men or pushing men toward believing in a, kind of a gender equitable view of things? And so I guess as I think about Uganda, do the many years of activism by women-led organizations around gender-based violence, do those seem to be filtering down into men's changes? In addition to our programmatic interventions, what do you see as some of the changes happening there? And Nancy, a similar question for Peru around, acknowledging the limits of our program interventions, but there's other forces, particularly years of important feminist activism in Peru. Do you see men reacting to those, knowing about those, kind of the changes that we see outside of our program spaces?
Jen, why don't we start with you? Yeah.
Okay. Yeah, and I wanted to ask too, is it possible for my colleagues in Rakai to answer too, or is it just us on here?
We can ask Fred. I can ask Fred to unmute.
Okay.
You would have to tell me.
Yeah, and oh, sorry, go ahead, Diana.
You would have to ask me, tell me again the names of the others.
Fred Nalagoda.
Yes,
and I think Robert Sekubugu, and I think William Dachi is here also. And while you're unmuting them, thank you so much, Gary, for that question. And I actually had a similar question that maybe it kind of promotes more discussion here. I had a question for you, Nancy. I really loved the part of I loved that your intervention was engaging male community activists. And yeah, my question is kind of a question in response to your question, Gary. So many questions and it's really along this line of this. I think that your approach, Nancy, is so innovative and so critically necessary for us to start doing more broadly. And I was really wondering, having not had this experience to work with male activists that are focusing specifically on violence prevention in Uganda, I was wondering if you could talk a little bit about what are some of the really important characteristics of male activists that could potentially be understood for creating these rules in other settings and training men and boys to become activists, so that this is something that we could start doing in different settings. And this is not to say this isn't being done in Uganda, but it's just something that I was really curious to learn from you on. And if my colleagues, Fred, Robert, and William would like to answer at all too, that would be fantastic.
Okay, thank you. Thank you very much, friends, and thanks, Jennifer, for delivering this on our behalf. I think the engagement of men as versus women, as Gary has described it, it is still really suboptimal in my own assessment. But it's picking up at a slow pace, though. I have seen or engaged with men who are involved in promoting these types of initiatives. They look so unique from a typical type of man that you would really expect to, So it is still a small docket of people trying to work with the relatively larger groups of women working on this. So this is an area that I agree we need to pay a lot more attention to see how well we can attract men to really get engaged, moreover at all levels, from schools, in communities, and in institutions like health facilities, etc. It is really, really suboptimal. Recently, there was a law on marital something, I don't even remember what it was really, that came to Parliament. A bill came to Parliament and it was passed that really tries to protect the rights of women further. You know, it relates well with the marital law that has been coming to Parliament and being bounced back. Finally, it was passed. It attracted a lot of tension from the communities all over the country. So this tells how much small things can really be. It is a lot. It means a lot. Yet there are so many other, laws that have been passed. Many of them are even more, I would say they are not so useful laws, and people haven't really paid much attention. But once this law came out, people paid a lot of attention. They said this and that, which makes me think that we really need to continue raising awareness and attracting men better for the whole community and the whole countries to really get engaged. So precisely, the engagement is still really suboptimal for men.
Thank you so much, Fred. It's great to have you here with us. Nancy, maybe we can hand over. Nancy, para ti, te doy la palabra.
Sí, muchas gracias. No sé si hacer primero mi pregunta o responder. ¿Qué propones, Diana?
Pues yo digo que respondas a la pregunta y después hazle sí la pregunta a Fiona, también se me hace una buena oportunidad. Gracias.
Claro, y también en realidad de alguna manera es una pregunta para Gary, o sea que creo que puede ser útil. Acabo de escuchar esta cuestión de la importancia o no de incorporar a hombres en esta lucha contra la violencia hacia la mujer, y eso me parece un buen comienzo. En realidad, en Perú van más o menos 40 años que el movimiento feminista comenzó a visibilizar lo que es la violencia contra la mujer, y éramos un pequeño grupo de mujeres feministas las que nos manifestábamos tratando de llamar la atención sobre el tema. Y ahora cambió mucho la situación. Ahora el tema de la violencia contra la mujer es un tema que está en el escenario político con mucha fuerza, y creo que el éxito de alguna manera, no el éxito, porque éxito sería pues lograr resolverlo, pero los logros obtenidos creo que son el resultado de un trabajo también constante y permanente, en el cual quiero reconocer el trabajo de Miguel Ángel Ramos, con quien trabajamos 20 años aproximadamente en la universidad, porque yo del activismo pasé a la universidad, del activismo feminista. Entonces, ese ha sido un excelente encuentro entre Miguel Ramos y yo, que hemos trabajado primero una investigación con la Organización Mundial de la Salud sobre violencia, en la cual, pero era un estudio con mujeres que nos dio la pista de la necesidad justamente de trabajar con hombres, porque no había nada que protegiera a las mujeres. Podían tener educación, podían tener empleo, podían estar muy empoderadas socialmente, sin embargo sufrían violencia por parte de la pareja. 1 de cada 2 es una proporción altísima, y en algunas zonas de Perú mucho más alta todavía, que sufrían cualquier forma de violencia por parte de la pareja, y la emocional ni que digamos, todas. Acoso sexual callejero, casi todas. Entonces, como universidad, y reconociendo el trabajo de las organizaciones feministas que ya habían desarrollado desde hacía más de 20 años, estoy hablando de inicios del 2000, creíamos que la universidad como centro académico podía desarrollar un trabajo diferente, y por eso es que nos interesamos en trabajar con hombres. Y lo primero fue este programa de hombres que renuncian a su violencia, que impulsó Miguel a lo largo de varios años, que fue un programa que eran hombres que voluntariamente se ofrecían, buscaban el programa justamente porque estaban en situación de crisis total, habían sido abandonados por sus parejas, qué sé yo, y este programa funcionó bajo un sistema de voluntariado y partiendo del principio que no es posible trabajar con otros hombres si los hombres que, digamos, dirigen el programa no se involucran y se comprometen a trabajar su propia violencia. Yo creo que ese es el principio que es como un eje de todas las intervenciones que hemos desarrollado. O sea, no es el cambio para otros, es el cambio desde uno y con los otros, ¿no? Y en ese sentido, creo que poco a poco se fueron generando grupos de hombres, colectivos de varones, que no necesariamente estaban en el programa, pero conocíamos a muchos de ellos. Varios se habían acercado al propio programa de hombres que renuncian a su violencia, a veces para aprender la metodología y terminaban comprometidos, involucrados, y otros por otras iniciativas que se desarrollaron en el país. Entonces estaba, por ejemplo, la Red Peruana de Masculinidades y otros colectivos en diferentes lugares. Y luego las cuestiones del azar y de la política en el Perú hicieron que Miguel Ramos fuera el primer director nacional del programa de lucha contra la violencia de género dentro del Ministerio de la Mujer. Y él impulsó justamente este tipo de programas de trabajo con hombres desde el sector público, porque siempre pensamos que la universidad tenía limitaciones, es un centro académico, y por lo tanto no es posible desarrollar programas que de repente puedan ser tan precarios en materia de recursos, ¿no? A pesar que nos preocupaba la sostenibilidad, porque esa es una condición. Sin embargo, era el sector público el que tenía que encargarse y de alguna manera eso ha funcionado. Hemos trabajado con el Estado y hemos trabajado también con el municipio de Lima y eso creo que ha dado resultados. Entonces, yo diría que es como una ola que va creciendo, que tiene avances y que tiene retrocesos, ¿no? Porque uno de los problemas serios es la complicidad entre hombres con relación no solamente a la masculinidad, sino a la propia violencia. Entonces hay que estar como atentos permanentemente a no caer en esa cuestión de la complicidad, ¿no? Yo diría que, bueno, esta combinación de investigación, activismo y relación con otros actores, incluido el Estado, ha sido fundamental para nuestro trabajo. Traté de ser breve.
Gracias, Nancy. Ya se nos acabó el tiempo. Tenemos ahora sí entrando preguntas de Rohini, Samantha Constant, Robert nos hizo buenísimas preguntas, pero lastimosamente se nos ha acabado el tiempo. So, Angelica, let me hand back over to you. I'm so sorry we didn't have questions, but we actually can now move to closing remarks by Angelica. I'm sorry, I was changing the language so you didn't have tech issues. And I just want to thank all the presenters. It was great to see all of you. The World Bank is super proud to partner with the Sexual Violence, to have partnered with the Sexual Violence Research Initiative to fund so many of your great studies that we can continue to learn from and implement into our programming. We'll try to connect those who ask questions in the end with the authors. So I know Samantha had two for Gary. Rohini will note your question, and then we'll connect you with some of the researchers to get responses to those questions. So Angelica, over to you.
Thank you so much, Diana. So thank you to everyone. It's fantastic to really have these global dialogues and learning experiences. And again, thank you so much to the Men Engage Alliance. And as I mentioned, all the presentations will be available in the Men Engage Symposium website and also in the SBRI website. So do visit our website, please. And as promised, and I think the key question about accountability, which is something that the Men Engage Alliance always put forward in this field, I think Lisa, you can share the word cloud. What is that people said in answering the question about what does accountability mean? Great. So we have big word responsibility, ownership, participation, inclusion, equity, and then the other smaller ones: respect, reporting, balance, consent, justice, feminist, feedback, critical, urgent, ask women involvement. So I think that's a kind of good picture of what do people feel about accountability in this space? And I think we always have to keep an eye on that, definitely. So thank you very much again to all of you. And just I will take the space as a facilitator to also mention that this SBI call for proposals, research proposals, is now open until the 2nd of August. So please do visit our website for more details. And I think Lisa will put the link in the chat as well. And once again, thank you for your attention, your participation. Stay safe. And of course, stay connected through the Men Engage Ubuntu Symposium. And thank you again to the panelists and Diana. Goodbye, everyone.